Welcome to our channel. So today we'll discuss about OET case notes for doctors, and I'm going to discuss the case notes. Patient name is Annie Hall. So here, first of all, let's read the task first so that we can just know like who is the reader. So if we go here, okay, the task says using the information in the case notes, write a letter of referral for further investigation and definite diagnosis to the gastroenterologist, Dr. Jason Roberts at Newtown Hospital, 111 High Street, Newtown. Okay, now here it's very clear the reader's name is Dr. Jason Roberts. He is gastroenterologist, and you are requesting further investigation and also final diagnosis for the patient. So here we can say that you might have done your provisional diagnosis also with the patient. That is why you are requesting him for the definite diagnosis. Okay, let's read the case notes now. Before that, it's very clear that our introduction should have three things. One should be name, problem, and purpose. So let's read the notes now. You are a practitioner examining a 45-year-old female patient, Miss Annie Hall. Date of birth is given to you and height, weight is given. So according to her weight and height, BMI is more than 25, means she's overweight. Social history, she's teacher and she's divorced, 2 children at home, non-smoker since children born. Okay, she's social drinker, mainly spirits. Okay, no substance intake, allergies are there, dust mites, codeine, sulfur dioxide. And moving further, her family history: mother hypertension, asthmatic, father peptic ulcer, maternal grandmother died due to heart attack, and maternal grandfather died due to asthma. Paternal grandmother unknown, and paternal grandfather died old age 94. Her previous medical history suggests that she's suffering from childhood asthma, chickenpox, measles. Her previous medical history says childhood asthma, chickenpox, measles. In 1983, she had tonsillectomy, and in 1990, she had hepatitis A. Whole family was infected, and then cyst was removed. Whiplash injuries there. Then in 2006, she suffered depression due to separation from husband. And then since 2008, she's overweight. And also since 2010, she has been suffering from upper respiratory tract infection, dyspepsia, dermatitis. Also, she has been prescribed oral and topical corticosteroids. Okay. Then on 18th of June 2018, she presented with the complaints of dysphagia, solids, onset 2 weeks ago, post-viral, even URTI, self-medicated. Okay, so here we need to keep in mind and also highlighted that self-medicated with OTC, over-the-counter Chinese herbal product, means she has been taking over-the-counter Chinese herbal product. See, now she is having like the provisional diagnosis. If we read here, okay, we'll just go forward. No relapse and no sensation of lump, no obvious anxiety, and concomitant epigastric pain radiating to back. Okay, and recent increase in coffee consumption. This is also we need to note down. And takes aspirin occasionally 2 to 3 times a month. Provisional diagnosis, that is, see, this also we need to pay attention here, is provisional diagnosis might be done by you as a doctor. So it is gastroesophageal reflux. So according to you, she is suffering from gastroesophageal reflux. However, you are asking some assistance from gastroenterologist to make the definite diagnosis. For the opinion also, moreover, endoscopy is also requested if required. And to decrease the coffee and alcohol intake, seize OTC product and also pantoprazole 40 mg daily. So now we have gone through the task here. Now it's very clear you are writing for a different diagnosis. This means provisional diagnosis might be done by you, but you are requesting help from gastroenterologist. Now, the provisional diagnosis, as we have read it, it is gastroesophageal reflux. However, you are asking this Dr. Jason for like Short diagnosis. So if you're asking assistance for definite diagnosis, this means you need to include information that is needed to confirm the diagnosis. So here you have to plan accordingly. You're writing for further investigation. So this is a real purpose of the letter, further investigation. And also this you need to consider when planning the letter, that you're referring for the opinion, and also you are asking that endoscopy can also be required. Now, like according to the case notes that we have gone through, now the main things that we need to include for the definite diagnosis are the reasons that you might think are the root causes of a problem. So, there are mainly three reasons that we can mention in the paragraph altogether. Like the first is over the counter Chinese herbal product, second is aspirin intake, and also you can write about her smoking. Here, if we go to the case notes, it is mentioned that she has been smoking, but she's a non-smoker since children born, and also she drinks alcohol. So, very clear to us. We'll be writing about the main causes, about her history. That also may be the main cause. That is like she has a history of this problem. And if she's not smoking now, then also we need to mention here, because here it is very clearly it is being said that she has been a smoker, but she's a non-smoker since her children's birth. So this means she's not smoking now, but she used to. So you need to mention here if she's not smoking, then also. Because if we'll not mention here, so after reading your letter, doctor will be confused also. That profession, that Mr. Jason, he may be confused that whether she smokes or not. So like to avoid that thing, we can mention that thing that she is not smoking right now. In the end, we'll mention about like non-smoking, social drinker. So how you'll say, please also know that Miss Hall has stopped smoking for many years. However, she's a social drinker, mainly spirits, and has a BMI of around 28.2. Then in the last paragraph, we'll write the further investigation and definite diagnosis. We'll request. In the view of above, I am concerned that Mrs. Hall's condition will worsen, and it would be highly appreciated if we can conduct further investigations and necessary management to confirm my provisional diagnosis. So this is how you have to plan your letter. Now, one of my students, she has written her letter and I have corrected it, but I want you to just have a look over that. So let's see. After going through the case note, let's plan our letter. So first paragraph, the introduction, you can write, I am writing to refer Miss Hall, who is presenting with symptoms suggestive of gastroesophageal reflux. So we'll use the word suggestive. Why? Because it is provisional diagnosis by you. So to you for further investigation and diagnosis. So we have mentioned the name also, the problem also, and also the purpose. In the second paragraph, we can mention about her family history. She has a family history of peptic ulcer. She was diagnosed with dyspepsia in 2004 and dermatitis in 2006, for which she was prescribed oral and topical corticosteroids. In the next paragraph, we need to give the details about 18th of June in 2010. Like she complained of dysphagia, no relapse, no sensation of lump, concomitant epigastric pain radiating to back level. So how you'll mention these things? You can say Miss Hall presented to my clinic on this date on 18th of June 2010 with dysphagia of solids, which followed a remittent course but did not feel any lump in her throat or stomach during swallowing. In addition, she complained about a concomitant epigastric pain which radiated to her back, specifically at T12. She also experienced weight loss of around 1 to 2 kilograms. Now, next paragraph, we can mention the details regarding her like URTI, that is over the counter medications, and contents are unknown. And we can mention in Miss Hall self-prescribed and over-the-counter Chinese herbal product with unknown ingredients for her upper respiratory tract infection. So avoid short forms here. She also reported to increase coffee consumption recently. Furthermore, she takes aspirin 2 to 3 times per month. This is a letter written by one of my students. Have a look. Dear Mr. Robert, fine, comma is here, so no mistake. In subject, there is a mistake. Miss Annie Hall, correct? However, she's writing aged 45. This should be small letter. A should be small. And also, there is no need to mention about teacher, divorce with two children in the subject. Only you need to mention is name and age or date of birth. Then, in the introduction, it's a very small introduction. Like I have discussed earlier with you, you have to mention the name, the problem, as well as the purpose of the letter. So you need to write that Miss Hall, who has been divorced and all, you can write this thing, and then you need to write her provisional diagnosis, her problem, and then why you are writing letter, like you are requesting for the further investigation. Or you can start like this: thank you for seeing Miss Hall, who has presented with this problem, and now this further investigations are being requested by your side. She has written that today she presented to the clinic as she had dysphagia with solid food for the previous 2 weeks. In addition, she had pain in epigastrium, which radiated to the back at T12 level. She had, and so this should be she has or she had. Either you write she has had, it's wrong. Start again after T12, okay, which radiated to the back at T12 level. Then she has written she had. It should be she had an episode of respiratory tract infection, taken Chinese herbal products before she suffered from dysphagia. Moreover, she has increased her coffee consumption and has been taking aspirin occasionally. Although she had noted some weight loss of 1 to 2 kilograms in past 2 weeks. There was no lump sensation in the throat. Then Miss Hall is an obese patient with BMI of this, or you can write she has BMI of 28.2 because you're already writing to a medical professional. She is an ex-smoker and a social drinker who is allergic to codeine. 4 years ago, she suffered from dermatitis and had to take steroids. In addition, she has a past history because history is already a past. You don't need to write had. It should be has. She has a history of depression, dyspepsia, and family history of optic ulcer. Then the main message, you can write my diagnosis is gastroesophageal reflux with the possibility of stricture, and I believe she might be a suitable candidate for endoscopy. Or you can write, I believe endoscopy may be required in this case. I would appreciate if you could take over Miss Hall for further management. Yours sincerely. Your name or the name of the doctor is not given, means who are you? You can simply write yours sincerely, doctor. That's it. To this letter, I would give C+, not B, because there are some mistakes which I consider are not suitable for B grade. So on the screen you can have a sample letter, and I'll be just showing it on the screen after this. So you can refer it and write down your own letter and send it to me for correction. Thank you. This is a letter. You can refer to this. This is according to what I have discussed with you, how you have to plan your letter and how it should look like. I hope you have liked this video and you'll follow my instructions and keep on practicing. I'll be coming again soon with another video and we'll discuss and more letters for you so that you can have a good practice with good assistance, and also everybody should score A grade. Or for sure everybody should get the desired grade. So thank you for watching. Stay tuned. Good luck. Bye bye.